through the 19th century, this becomes what today we would call the standard of care. So every major diabetes physician in the UK and the US and Europe, and again, diabetes is a rare disease, there aren't a lot of these guys, but the ones who are studying and the ones who are making their careers treating it are using what was called the animal diet. It's effectively keto today. And this was very successful with the patients that today we would say have type 2 diabetes, and it could delay the progression of type 1 diabetes, so those patients lack insulin, so that's a fatal disease until insulin is discovered. And insulin is discovered in 1921, and all of this is thrown out. Suddenly you've got this very powerful drug. It's so good at lowering blood sugar that it creates the condition of hypoglycemia, low blood sugar. So now you've got a disease of carbohydrate metabolism, so the patients can't metabolize carbohydrates. You treat it with this incredibly powerful drug, and that drug requires them to eat carbohydrates so that the drug itself doesn't kill them. So in the course of like 2-3 years, you go from telling these patients you can't eat any of these foods to making sure they eat them regularly so that the cure doesn't kill them. And from then on, the 1920s onward, diet becomes kind of an adjunct to drug therapy. So the idea is we're going to pay lip service to diet. We're going to tell the patients what they have to do with their diet, which is with insulin, they have to eat a set amount of carbohydrates at every meal and at snacks, and to make sure they don't have low blood sugar and die from that. And then we're going to give them enough drugs to cover any of the sins that come from this diet. And again, that philosophy basically is what we're living with today, 100 years later.